Welcome to EQUUS Farm Calls, where we take horse owners along with us to discuss important topics on equine health and care with industry experts. Today, we're talking to Dr. Kyla Ortved about equine arthritis. EQUUS Farm Calls is brought to you in 2022 by Farnam, the makers of Apple Elite electrolytes. An electrolyte supplement can't work if your horse won't eat it. Keeping horses hydrated in the heat of summer during competition or other stressful situations can be challenging, especially if they sort powders and pastes are not an option. For horses that are picky eaters, Apple Elite electrolyte pellets is a simple way to encourage water consumption and help maintain hydration year-round, which is important for proper digestion, muscle function, and recovery. These tasty apple-flavored pellets are formulated with a balanced electrolyte profile of the vital minerals needed to help restore your horse's electrolyte levels. Help your horse stay hydrated and keep fluid levels in balance, no matter what the day brings, with Apple Elite electrolyte pellets. I'm Kim Brown, group publisher of Equine Health Network. Dr. Ortved, who is a DVM and a PhD, also is a diplomate in the American College of Veterinary Surgeons. She's the Jock Jenney Endowed Term Chair of Orthopedic Surgery at the University of Pennsylvania's New Bolton Center. Thank you, Dr. Ortved, for joining us today on EQUUS Farm Calls to talk about equine arthritis.
Thanks so much for having me, Kim. It's great to be here.
We're really excited about this, and I hate to tell our audience, but we actually were talking about one of my older geldings here, that has arthritis and so forth. But really, Dr. Ortved, how widespread is equine arthritis in the horse industry?
Yeah, it's a great question, Kim. And I think you bring up a good point, especially when you mention your older horse, because that is the population of horses and of people that we think of having arthritis pretty ubiquitously. But for sure, we know that arthritis is much wider spread than that, both in horses and humans. So younger athletes are much more likely to be affected with arthritis due to the wear and tear they put on their bodies. So in horses specifically, we know that most of the horses that we have, and in the different disciplines they're in, are quite athletic. We ask a lot of them, and they honestly want to do a lot. It's in their nature to be quite athletic, and whether that's racing, jumping, reining, any sort of discipline, they are using their bodies tremendously. And in terms of, I should probably take a step back, in terms of what arthritis is, it simply means degeneration of the joints in our body. And our joints are covered, the end of the long bones are covered with articular cartilage, or the cartilage of the joint. And cartilage is an amazing structure in terms of it provides this amazing cushion for us in all the things we do. And when I say us, I keep going back and forth between humans and horses because there are so many similarities. So this cushion that we have is a pretty tremendous tissue in the body, but it does have its limits. And so when we use it, it does encounter some just general wear and tear with the things that we do. And if we're a little rougher, it's gonna encounter a little bit more wear and tear. And then some things can put your cartilage even more at risk. And so I use examples like if you have some horses will have conformation where they have more pressure on the inside of the limb than the outside. And so you can imagine if you're dealing with two cushions on top of each other and one side has more pressure than the other, that cartilage is going to have more wear and tear than the other side. Oh. Another example would be a horse that has a fracture within a joint. When a fracture goes through a joint, it also disrupts the cartilage. So there's lots of things that can affect the cartilage over time within any sort of athlete's career. One last example I'll use is something like a cruciate injury. So an ACL injury in a human puts your knee at risk of developing arthritis because it changes the function of your knee and sort of the stability of your knee. So all of these examples I'm giving are not necessarily the arthritis we think of just affecting the older generation. It's really something that we are considering in the younger population of horses, and these animals can develop arthritis at that time, and it may not be very severe, but the other thing we do know about arthritis is that cartilage, although it's an amazing tissue and I've sung its praises, the one thing that is not good at, it is not good at healing. So if it gets worn down, if it gets damaged, it doesn't heal itself very well. And that can lead to progressive degeneration of the joint. And that's when we start to see sort of the wider spread consequences of arthritis. The joints get stiff. They lose their normal range of motion. We get bone growing around the joints to try to stabilize things. We get pain, we get swelling. So all of these things are recognized consequences of the joint kind of undergoing its process of degeneration. So all of sort of, to recap all of that, Kim, one sort of segment of arthritis, lots of things can cause arthritis. And when I'm going to use another example, we think about some of the inflammatory arthritis that you see in humans, like rheumatoid arthritis. We don't appreciate any of that in the horse. So the arthritis that I'm really referring to is related to joint wear and tear or joint trauma. And so therefore, it can affect any age. And we may not see the very serious consequence of it until the horse is older, but we can appreciate it in the younger population of horses. And the last take-home message of that is that our understanding of this disease as a process with a beginning and an end, and our potential to recognize and diagnose it in the earlier stages, that's where we can intervene and potentially change the course of the disease through different therapeutics, and potentially affect the horse in a way that it's not going to develop severe arthritis in the future.
You've made so many great points here, and I've been taking a few notes. While we're on this diagnosis, treatment, and prevention, let's talk about that a little bit. How does a vet, if your horse seems to be getting a little stiff, no matter its age, especially if it is an older gelding like I've got, but how would a veterinarian diagnose, and when as a horse owner should you say, hey, I'm worried about arthritis in my horse?
Yeah, another great question, Kim. So I think something that has come about in terms of horse ownership and and equine medical care is that we're dealing with a population of people that, whether they're a trainer, an owner, a manager of horses, that are really keen and astute observers of their horse. And early arthritis can present in many different ways. And so you have these people that are very in tune with their horse, and they say, you know what, it's not, something feels a little bit off in the hind or in the right forelimb. I can't put my finger on it, but the horse just feels a little bit different. And so that can be an early sign that something is not quite right, all the way up into my horse is suddenly limping and I've noticed it, and it's not getting better. And so that can be a bit more of an obvious sign. So everything from subtle performance changes to more obvious lameness issues can be a sign that something's not right. I think in terms of as veterinarians, how we evaluate these horses is obviously just starting with a physical exam and looking at all the joints in the limbs of the horse. And the other thing we have to think about in terms of arthritis is that in horses, we see quite a bit of neck arthritis. So looking at the neck and the back, and just doing your physical exam and seeing if there's any localizing signs like heat, pain, swelling of a joint, decreased range of motion, stiffness. And then from there, especially if a horse is having some gait asymmetry or some lameness, using our ability to do nerve blocks and joint blocks to localize the source of the pain. And once we localize the source of the pain, then we can start to use our diagnostic imaging options to really look at the joint. So often our first go-to would be an X-ray. And x-rays are really nice because they are portable, they're relatively affordable, and they can give you a really good image of the bones of the joint. The one major downside of x-rays, especially in terms of arthritis, is that it's not very sensitive in the early stages of arthritis. So we, and everyone I think can probably picture an image of an x-ray where even with an untrained eye, you can say, gosh, there's all this bone, extra bone around the joint, and it looks very irregular, or the joint looks collapsed. That those are signs of arthritis. We know there are signs of arthritis. But once that's happened, that's sort of towards the end stage of the joint. And often you'll hear people say either my horse has it, or I have an end stage joint, or I have bone on bone, or my horse has bone on bone. And once that's happened, our ability to change the course of the disease process is very limited. So earlier recognition of arthritis, like I mentioned in the first part, is really a key point. And things that we can use to recognize arthritis a little bit earlier would be things like ultrasound, where we can look at the joint fluid, we can look at the margins of the joint. And then the other sort of more advanced imaging that we've had in our wheelhouse more recently, which has really changed our ability to diagnose earlier. And this is certainly the way that human doctors will go with human patients, is using things like MRI and CAT scans to get a in-depth look at the joint. I think those are sort of our, if we're using our diagnostic imaging options to make a confirmed diagnosis. You'll also see a lot of veterinarians make a presumptive diagnosis. And when I say that, I say we localize the lameness to a specific joint, and we can say, okay, this joint is causing some pain. The x-rays look normal, but we're going to use, our best assumption in terms of what's most likely, and say there's probably some inflammation in the joint, maybe a little bit cartilage, maybe a little bit of cartilage wear and tear. And we're going to try to treat that joint now and try to prevent the joint from having more damage as we move forward. So I think that's also another very useful option that we have in terms of managing these joints.
That is such a great thing. So when you talk about treating joints, and you don't have to mention products by name, but what are some of the things that we look at when we're looking at trying to treat arthritis in horses?
Yeah, so in terms of treatment of arthritis, we have a huge arsenal for treating joints, and I sort of break them up into physical therapies, medical therapies, and then surgical therapies. So I'm going to start with the easiest. For physical therapies are anything that you're going to do either manually or with some sort of physical change within the joint that's going to hopefully improve comfort and decrease inflammation and potentially slow the progression of arthritis. And when we think about those things, honestly, one of the most simple things is controlled exercise. And I think it's a really important point, because there's a lot of people, when you hear your horse has arthritis, they freeze and they want to protect the horse and they want to put the horse in a stall and let it rest forever. And just like us, if you have arthritis in a joint, anyone who has arthritis knows that if you sit and do nothing, it gets stiffer and stiffer and stiffer, and you feel worse. And it's the same with a horse. So just simple exercise, control. You're not going to force your horse with really bad arthritis to go jump a 4-foot course, but turnout, controlled exercise, ridden work, as long as the horse is comfortable, is very important for providing some comfort, allowing the horse to be comfortable, use the joint, and sort of maintain its range of motion. So that's one thing that's, I think, really important. Some of the other physical therapies we think of are cryotherapy. So any cold therapy can help decrease inflammation around a joint. Shockwave therapy can be very useful for increasing comfort and potentially improving healing of joint structures. And there's a few other things that we don't have a ton of evidence they work, but anecdotally, some owners really like them and feel like they offer more comfort to the horse. And those would include things like laser therapy, electromagnetic therapy. So there's a whole slew of physical therapies that we can do to the horse or to the joint that will help them feel more comfortable, decrease some inflammation, and potentially decrease the progression of disease. In terms of medical therapy, I would say the most common thing that we think about is joint injections. And within the category of joint injections, there's a couple main categories, and one would be corticosteroid injections. And there's many options of steroids that we can use for joints. And I think steroids can be really effective at reducing inflammation and reducing pain in a very fast manner. We do need to be somewhat judicious in our use of steroids, because if we overuse them, if we use really high doses, or if we use them in inappropriate settings, so potentially a horse that has metabolic disease, we have to be a little bit careful with the steroid administration in those horses because of the risk of laminitis, for example. But if we use them judiciously, they can be very effective in the ways that I mentioned. Another category is trying to lubricate the joint. If you take the fluid out of your joint, it's very viscous. It has this sort of sticky, stringy feel. And when the joint starts to get arthritis, it moves more into a watery substance, and it's not as good at protecting the cartilage. So something like hyaluronic acid, hyaluron injections can be helpful in terms of offering more lubrication to the joint. The next main category is the regenerative medicine therapies. And I'll just mention a couple and then sort of briefly discuss how they work. But the main ones that we think of include the products that are derived from the horse's own blood. So blood is taken sterilely, it's processed in different ways, and it produces different products. And that could be something like platelet-rich plasma, IRAP, A2M, Prostride. These are all different commercially available substances that can be then used to inject the joint. One of the other main regenerative medicine products would be stem cell therapy. So either the horse's or another horse's stem cells are retrieved and then injected into the joint. And the way that sort of the blanket, I don't want to oversimplify it, but the blanket statement of how those work, all of those products work, is that the blood-based products and the stem cells are all really, they decrease inflammation and they provide growth factors that have healing properties within the joint. So you're going to decrease your inflammation and give the joint the best possible place from which to heal with all the growth factors that are in those products. There are sort of a newer category of injection, and those are the polyacrylamide gels. Yeah. And these gels we don't have all the details on how they work, but we know that they change the sort of function and structure of the joint capsule. And by doing that, they make the joint a better environment from which to move and potentially to heal. And those would be the things like Noltrex and Arthrimid, which are now available in the United States. And there are some lubrication properties of that product as well.
Yeah, and those, I mean, just so horse owners don't think we're sticking stuff in horses that we don't know anything about, those have been used in humans for a while.
Yeah, so the polyacrylamide gels, and it's certainly there's data in the literature that supports their use. It's just something that, because it's newer, we don't know a ton about them yet. Right. But there's certainly been research studies and clinical trials with them showing how they affect joints.
Yeah. And I'm going to go back to prevention just a little bit, because I think what you said earlier is so important, that horse owners, trainers, the people who are around the horses on a day-to-day basis, if they can observe this and have their veterinarian come in and make a diagnosis of potential arthritis, even in a young horse, there are things that can be done to help physically and medically extend this horse's life as far as its joints are concerned.
Yeah, absolutely. So in terms of prevention, I think the first, just recognizing how your horse moves, how its conformation affects its limbs, and getting a good sense of the soundness of your horse, so you can recognize if anything is off. There are certainly a large amount of supplements available in terms of preventative for arthritis, and I'm not a big supplement person, only because there has not been a lot of research done on them. So I think there's a lot out there that don't have any proven efficacy, and I think that can be problematic. There are some that certainly have more evidence behind them than others, and I'm talking mainly about oral supplements in those cases. So the chondroitin sulfates, the hyalurons, all of those things that can be glucosamines, all of those that can be administered orally through different products. I will say that probably the most researched and evidence-backed thing that can be used in prevention of arthritis would be Equine. So Equine is a polysulfated glycosaminoglycan, which is a long term, but we can just say PS-GAG. But it's an important part of cartilage and synovial fluid. And Equine's been on the market for a long time and can be administered just intramuscularly and has been shown to improve joint health. And so I think using something like that as a preventative for your horse, especially in a time where the horse has undergone some sort of joint trauma. It stepped and took a weird step and has some swelling in the knee, or it's going into a really hard show season. That may be something that you would consider, okay, this is a time where we're really going to try to protect our joints. In terms of prevention, I think there are certainly, I don't think we can you could try to bubble wrap your horse, but really, just being really in tune with them, and trying to recognize things early, seeking medical help when you think it's indicated. And then, like I said, supplements, judicious use of supplements, and then Equine. And there's obviously other injectables that are in sort of the category of Equine. Pentosan, polyglycan, and the reason I'm just referring back to Equine is simply because that's the product with the most research that's been done, so we know that it is efficacious.
And I have to mention one thing, because you and I talked about this in another when we actually were talking about veterinarians and working with horses, is having a good farrier can make a big difference in your horse.
Yeah. Kim, absolutely. I should have, and I'm trying to remember all the little pieces, but that should definitely go within the physical therapy part of treatment and prevention. So having a good farrier and having a good relationship with your farrier. And then I also think what's really important, I'm very lucky to have a farrier on site in New Bolton. That's incredible. And so we work as a team that includes our farrier, Pat Riley, the veterinarian here, which would be me or one of the other veterinarians, the veterinarian on the farm, and then the owner or trainer, and really come up with a plan that's going to support the horse the best way that we can do that. And I think one of probably the most important thing that I've learned about farriery is that horses are all different, and just like we all are, you may prefer a Nike running shoe, but I like an Asics running shoe better. I think horses, if we follow a prescription of this, all horses that have this problem need this, I think we get into trouble. And sort of being open to different ways of shoeing and managing and working with the horse, and also trying not to get the horse to conform into your specific way that you think it should be, because obviously all horses are a little bit different. I think that's really important as well.
Well, I mean, we could go on talking about this all day. This is one of those things that I have dealt with, as most horse owners have. And I really appreciate you taking the time today to join us on EQUUS Farm Calls and talk about equine arthritis.
No, my pleasure. And Kim, you're absolutely right. This could be a topic for hours and hours and hours. But it is really important, and it is something that unfortunately affects most of us. So it's good to have your knowledge base and recognition, because there are definitely things that we can do to help the disease process and help our horses. I appreciate you giving me the time to talk about it.
Well, thank you again, Dr. Ortved, for joining us. And thanks to our audience for being with us today on EQUUS Farm Calls. And we welcome your input and hope you'll let us know if you have suggestions or comments. You can email me at kbrown, that's the letter K Brown, at equinenetwork.com.